Hi everyone! Today I'm going to help you remember the key symptoms of malaria using a simple and powerful mnemonic. F-E-V-E-R. Each letter represents an important symptom, and I'll also explain briefly why it happens. So let's get started. F stands for fever, which is usually cyclical or intermittent. Malaria parasites multiply inside the red blood cells, and when they burst, they release toxins into the bloodstream. These toxins trigger the body's immune response, causing a sudden rise in temperature followed by chills and heavy sweating. The fever comes and goes in cycles, which is a classic sign of malaria. E stands for enlarged spleen, also known as splenomegaly. The spleen acts like a filter, removing old and infected red blood cells. During malaria, it has to work much harder, which causes it to swell. This can lead to a feeling of fullness or discomfort in the upper left part of the abdomen, sometimes with mild pain. V stands for vomiting and nausea. The toxins released by the parasites irritate the stomach and also stimulate the vomiting center in the brain. As a result, patients may experience frequent nausea, poor appetite, or even repeated vomiting. This can easily lead to dehydration if not managed properly. The second E stands for elevated liver enzymes or liver involvement. After entering the body, malaria parasites first infect the liver. Continuous infection causes inflammation and mild liver damage, leading to increased enzyme levels in the blood. That's why patients can develop jaundice, which is yellowing of the skin and eyes, along with loss of appetite and abdominal discomfort. Finally, R stands for rigors, which means chills and shivering. When the infected red blood cells rupture, the sudden release of waste products and toxins causes the body's temperature control center to overreact. This leads to intense shivering and chills, followed by profuse sweating as the fever breaks.